Welcome to our deep dive into anxiety, its various types, and how it can be managed through psychological practices. You know, in my line of work, I see a lot of folks grappling with anxiety. It can be absolutely debilitating, keeping you from living your life to the fullest. But let me tell you something. You don't have to suffer in silence. We're going to break down the different ways anxiety can show up in your life, and more importantly, give you some tools to take back control. Let's start by exploring the different types of anxiety disorders recognized in psychology. Now, anxiety itself is a normal human emotion. We all feel it from time to time. It's that fight or flight response kicking in when we face a perceived threat. But when that anxiety becomes excessive, persistent, and starts interfering with your daily life, that's when it crosses the line into an anxiety disorder. And let me tell you, there are several types, each with its own set of symptoms and challenges. First, we have generalized anxiety disorder, commonly known as GAD. This type involves persistent and excessive worry about various aspects of life, even everyday things that most people wouldn't find distressing. We're talking about work, finances, health, family, you name it. These folks are constantly on edge, worrying about what might happen, even when there's no logical reason to be so anxious. They might have difficulty sleeping, experience muscle tension, fatigue, and have trouble concentrating. They're just wound up tight all the time. Chapter 3. Panic disorder. Next is panic disorder, characterized by sudden and repeated episodes of intense fear accompanied by physical symptoms. These episodes, known as panic attacks, can be incredibly overwhelming and distressing. They often come without any warning and can last for several minutes, leaving the person feeling exhausted and drained. These panic attacks can come out of nowhere, like a bolt from the blue. One moment you might be feeling perfectly fine, and the next you're gripped by an intense wave of fear and anxiety. It's as if your body goes into overdrive, reacting to a threat that isn't there. Imagine this, you're going about your day, and suddenly your heart starts racing, your chest tightens, and you feel a sense of impending doom. It's as if your body is sounding an alarm, but you can't figure out why. This can happen while you're walking in the park, driving, or even sitting at home. You feel like you can't breathe, you're sweating, maybe even chest pain. It's terrifying. The physical symptoms can be so intense that many people think they're having a heart attack or some other life-threatening condition. This only adds to the fear and panic, creating a vicious cycle that's hard to break. People with panic disorder often live in fear of having another attack. This constant worry can be debilitating, affecting their daily lives and routines. They might start to avoid situations or places where they've had a panic attack before, fearing that it could happen again. This can lead to avoidance behaviors. For example, they might stop going to crowded places like shopping malls or concerts, or they might avoid driving or traveling. The fear of having a panic attack can become so overwhelming that it starts to dictate their choices and actions. They might stop going to certain places altogether, preferring the safety and comfort of their own home. This can lead to isolation and loneliness as they withdraw from social activities and interactions. They might miss out on important events and milestones, further impacting their quality of life, or engaging in activities they once enjoyed, such as hobbies, sports, or spending time with friends and family. The fear of having a panic attack can overshadow the joy and pleasure they used to find in these activities, making them feel disconnected and detached from their own lives, all because they're afraid of having a panic attack. This fear can be paralyzing, preventing them from living their lives to the fullest. It's important to understand that panic disorder is a real and serious condition, but with the right treatment and support, it is possible to manage the symptoms and regain control over one's life. Chapter 4. Social anxiety disorder. Another common type of anxiety disorder is social anxiety disorder, where individuals experience overwhelming anxiety and self-consciousness in social situations. This isn't just about feeling shy or nervous, it's a deep-rooted fear that can be debilitating. Imagine being at a party, surrounded by people and feeling like every eye is on you, judging your every move. The anxiety can be so intense that it feels like a physical weight pressing down on you. These folks are terrified of being judged, humiliated, or rejected by others. It's not just a fleeting thought, it's a constant nagging fear that can dominate their lives. They might replay social interactions over and over in their minds, analyzing every word and gesture, convinced they've made a fool of themselves. This fear can be so overpowering that it affects their ability to function in everyday situations. They might avoid social gatherings altogether, or if they do force themselves to go, they're a wreck the whole time. The anticipation of a social event can be just as stressful as the event itself. Days, even weeks before a gathering, they might experience sleepless nights, stomach aches, and a racing heart. And when they do attend, they might stick to the edges of the room, avoiding eye contact and conversation, just trying to get through it. Public speaking, forget about it. For someone with social anxiety disorder, the thought of standing in front of a crowd and speaking can be paralyzing. They might worry about stumbling over their words, forgetting what they wanted to say, or being judged harshly by the audience. This fear can be so intense that they might avoid opportunities for advancement at work or school just to avoid the spotlight. Even simple interactions like making eye contact or ordering food can feel excruciating. They might rehearse what they want to say over and over in their minds, only to freeze up when the moment comes. The fear of being judged or making a mistake can make even the most mundane tasks feel like insurmountable challenges. This constant anxiety can take a toll on their mental and physical health, leading to feelings of isolation and depression. It's like they have a spotlight shining on them, amplifying every little flaw they perceive in themselves. This intense self-consciousness can make them hyper-aware of their actions, words, and even their appearance. They might worry about sweating, blushing, or trembling, convinced that everyone is noticing and judging them. This constant scrutiny can be exhausting, making it difficult to enjoy social interactions or build meaningful relationships. Understanding and empathy from others can make a significant difference, helping them feel less alone in their struggles. Chapter 5: Management Techniques. Now for the good stuff: managing anxiety. Anxiety can feel overwhelming, but there are numerous strategies to help you regain control and find peace. It's important to remember that managing anxiety is a journey, and it's okay to take it one step at a time. The first thing I tell my patients is this: you're not alone. Anxiety is a common experience, and many people around the world are going through similar struggles. Connecting with others who understand what you're going through can be incredibly comforting and empowering. Millions of people struggle with anxiety, and there are effective treatments available. It's crucial to seek help and explore the various options that can make a significant difference in your life. Whether it's through therapy, support groups, or self-help resources, there is hope and help available. One of the most powerful tools in our arsenal is cognitive behavioral therapy, or CBT. CBT is a structured, goal-oriented therapy that focuses on identifying and changing negative thought patterns and behaviors. It's a collaborative process where you work with a therapist to develop practical skills for managing anxiety. This approach helps you identify and change those negative thought patterns and behaviors that are fueling your anxiety. By keeping a thought record, you can track your anxious thoughts and learn to challenge them. This process can help you gain a new perspective and reduce the intensity of your anxiety. It's about challenging those irrational thoughts and replacing them with more balanced ones. Cognitive restructuring exercises can help you reframe your thinking and develop a more positive outlook. This shift in perspective can lead to significant improvements in your overall well-being. Mindfulness practices like meditation and deep breathing can also be incredibly helpful in calming the nervous system and bringing you back to the present moment. These techniques can help you develop a greater sense of awareness and control over your thoughts and emotions. Regular practice can lead to long-term benefits in managing anxiety, and in some cases, medication might be recommended to help manage the symptoms. Medications can be an effective part of a comprehensive treatment plan, especially when combined with therapy and other self-help strategies. It's important to work closely with your healthcare provider to find the right medication and dosage for your needs. The key is to find what works best for you and to be patient with yourself. Everyone's journey with anxiety is unique, and what works for one person may not work for another. It's important to explore different techniques and be open to trying new approaches. Remember, progress takes time, and it's okay to seek support along the way. Engaging in activities that bring you joy and fulfillment can also play a significant role in managing anxiety. Whether it's through creative outlets, physical exercise, or spending time with loved ones, Finding ways to nurture your well-being is essential. Be kind to yourself and celebrate the small victories as you work towards a healthier, more balanced life. Outro, taking control of your anxiety. Thank you for watching. If you found this video helpful, please like, share, and subscribe for more content on mental health and psychology. Remember, anxiety doesn't have to rule your life. By understanding the different types of anxiety and seeking professional help, you can learn to manage your symptoms and live a fuller, more meaningful life. You've got the power to take control.